If you have high levels of potassium in your blood, it can cause problems with your heart rhythm. Sodium polystyrene sulfonate helps your body to get rid of the extra potassium. This medication is used to treat this condition. It is important to take this medication as directed by your doctor. The daily dosage and the best time to take it will depend on your specific situation, so make sure to follow your doctor's instructions carefully. Before using Kionex, make sure to shake the bottle well. Do not heat this medication, as it may not work as effectively. If taking Kionex by mouth, follow your doctor's instructions, usually 1 to 4 times a day. Use a special measuring device to carefully measure the dose, and avoid using a household spoon. Stay upright for at least an hour after taking the medication. Sodium polystyrene sulfonate may affect the absorption of other medications. Take your other medications as directed by your doctor, usually at least 3 hours before or after taking Kionex. If using Kionex rectally as an enema, use the prescribed dose every 6 hours as needed. Follow your doctor's or pharmacist's directions on how to prepare and administer the enema, and use a non-sodium containing enema for cleansing before and after taking Kionex. The dosage and length of treatment for Kionex are based on your medical condition and response to treatment. Follow your doctor's instructions carefully, and do not exceed the recommended dosage or duration of use. If you experience loss of appetite, nausea, vomiting, or constipation while taking Kionex, it's important to let your doctor or pharmacist know. To help prevent constipation, make sure to include enough dietary fiber, drink plenty of water, and stay active. You may also need to use a laxative, so it's best to ask your pharmacist for advice on which type is right for you. Remember that your doctor has prescribed this medication because they believe the benefits outweigh the risks. While many people using this medication do not experience serious side effects, it's important to seek medical attention if you notice any muscle weakness or spasms, fast or irregular heartbeat, mental or mood changes, or swelling of the hands, ankles, or feet. Kionex may cause rare but serious intestinal problems, such as bleeding or blockage. Seek medical help immediately if you experience severe constipation, stomach pain, black or bloody stools, or vomit that looks like coffee grounds. Additionally, seek immediate medical attention if you experience paralysis or seizures. Although rare, a serious allergic reaction to Kionex is possible. Seek medical help if you notice any signs of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not mentioned. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Kionex, it's important to talk to your doctor or pharmacist if you're allergic to it or if you have any other allergies. This medication contains a large amount of salt, sodium, so it's important to avoid using salt substitutes that contain potassium without asking your doctor first. If you have kidney problems, heart failure, high blood pressure, or swelling in your hands, ankles, or feet, it's important to follow your doctor's instructions for limiting the amount of sodium in your diet. Before using Kionex, it's also important to tell your doctor or pharmacist about your medical history, especially if you have stomach, intestine, or bowel problems, or if you have a low level of potassium in your blood. Before having surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that older adults may be at a greater risk for severe constipation when using this medication. Additionally, Kionex must not be given by mouth to newborns, especially premature infants, and caution is advised when using this medication rectally in newborns and children. If you are pregnant, make sure to inform your doctor before using Kionex. However, this medication does not pass into breast milk and is unlikely to harm a nursing infant. It's still important to consult your doctor before breastfeeding. When taking Kionex, it's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Kionex include antacids/laxatives that contain aluminum, calcium, or magnesium, such as aluminum carbonate, aluminum hydroxide, calcium carbonate, and magnesium hydroxide. Also, it's important not to use any laxatives that contain sorbitol with Kionex, as doing so may increase the risk of intestinal problems. Take note of this information to ensure the safe and effective use of Kionex. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include changes in mental state or mood, muscle weakness, rapid or irregular heartbeat, slowed breathing, and paralysis. Remember to seek medical help as soon as possible if you suspect an overdose of Kionex. It is important not to share Kionex with others. Your doctor may need to perform regular lab and medical tests, such as checking your blood levels of potassium and other minerals, as well as an EKG, while you are using this medication. It is important to attend all scheduled medical and lab appointments. Be sure to consult your doctor for more information. If you forget to take a dose of Kionex, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take your next dose at the regular time. Don't take a double dose to make up for the missed one. When it comes to storing Kionex, it's important to keep the product tightly closed and follow the directions on the package. Some brands may need to be refrigerated, while others can be stored at room temperature. It's best to ask your pharmacist for more details about the specific brand you are using and when it should be discarded. And remember, don't store it in the bathroom and keep it out of reach of children and pets. When it comes to discarding Kionex, don't flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product when it's expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.